Hello, this is Maria Brennan-Thorns here with one of my early patients, Gin. And Gin has been with me for 15 years from when I first started, and her very first treatment was lip enhancement treatment. Nowadays we have 3 bigger clinics, MBNS in Tame and Cutis in Witney and Abingdon. And I want to film today to show you Gin having the new treatment called lip enhancement using Volbella, which is made by Allergan. And Volbella lasts 12 months and it's newly launched in the United Kingdom this year. So this is Gin, and she is sitting in with me for treatment today. So Gin, what would you like today?
I'd like my lips enhanced. You've been doing them for about 15 years.
Yes.
And I think it's time I had them done again.
Yes. And we're going to be using the Volbella. Why did it interest you?
Well, I think that this one lasts a bit longer.
Yeah.
I hope it lasts about a year.
Yes.
Which would be wonderful.
Yes.
If I could have that done.
Now, can you tell me exactly what you'd like to have done to your lips so that we've got a treatment plan?
Right. I quite like the look when you do that. So it's a bit more full.
Yeah. So the corners.
The corners.
Yeah.
Bit more volume.
Bit more volume. Yes.
In there.
Yeah. Any lines and wrinkles around the area of the lip body that you'd like me to sort out?
I would. The usual lipstick lines,
Yeah.
which are always a bit worse this side, and sometimes here.
Yes.
I feel it's looking a bit sad.
Okay.
So.
Well, I will do that, and this treatment, it has lidocaine in it, and I know you're used to having that, but as always we'll put you some local anaesthetic cream on before the treatment, and we'll use Volbella, which is the new Allergan product, which is especially for lips. It's an excellent product in that it has a good longevity and has clinical evidence base of lasting for 12 months and sometimes a little bit longer in the patient's lips. So I'm going to wipe Ginny's lips and we're going to do a very straightforward lip border enhancement, treating her mouth corners, marionettes and her perioral lipstick. Injection into the corner of your margins of your lip. But it creates a bit of a line here. So I'll come back to that line and fill that when I've done the other side. See, that's lifting that side up nicely. Turn that way. Brilliant. Are you alright? Mm-hmm. Sorry, that hurt you a little bit, didn't it? I'm so sorry. Because the product itself has got lidocaine in the mix, it sort of like gets less painful the more that... This is where I like to just sit up a little bit at the corners and not follow the natural line into the corner of the mouth, but to bring that lift. Add some volume, a little bit of subtle volume to Gin's upper face, which will help her look less tired and bring her mouth corners up. And I'm using Voluma. Okay, Gin, you ready? Mm-hmm. Keep your eyes closed.
Okay.
Okay, you'll feel some heavy... That's it, well done. Just put a little bolus dose in there. What I do is I tend to just build columns from the lower dermis to the upper dermis, tailing off in this area of weakness that we looked at a minute or so ago. Some little doses of Voluma here to give more lift to the mouth corners and to give a more rounded 3-dimensional cheek. So Ginny's now finished her treatment. We've applied some sterile Lyca gel camouflage makeup, which has got an anti-inflammatory in it. And how do you feel?
It's wonderful.
Yeah?
Yeah, it's almost as though I haven't had a treatment.
Yeah, and your
very
lips
comfortable.
look good.
Thank
yeah,
you.
You're happy with your cheeks?
I am.
Has it achieved what we hoped for?
I hope so.
Yeah.
Do you think?
I think it looks great, and we'll see you in 2 weeks' time for a
Lovely.
checkup.
Thanks, Maria.